Today we have with us Dr. Hong Lei, who is the Medical Director of Sports Medicine here at Brown, Beth Conroy, who is Associate Head Athletic Trainer, Dr. Britton Davis, Clinical Sports Psychologist, Dr. Joe Walsmith, who is Senior Associate Director of Athletics for Wellness and Performance. You might remember Joe and Beth from our last webinar, part one. We also have Lori Connolly, who's Student Accessibility Service Accommodations Specialist, and Tracy Bergeron, our sports dietitian. So we've got a great group for you today, and we'll get started with Dr. Joe Walsmith. Joe, do you want to get us headed in the right direction?
Terrific. I sure can. Thank you for the introduction. Appreciate it. First of all, I want to welcome everyone here on the call. And congratulations to everyone here, whether it be parents or student athletes on the call. What an incredible opportunity you have ahead and journey ahead. I was a student athlete at Brown back in the day. I played on the men's soccer team and can appreciate what an incredible experience and journey is ahead. I think big picture, I'd like to share with everyone sort of philosophically how we think about wellness and performance across Brown athletics, and also critically our partnerships in health and wellness, University Orthopedics, which provides musculoskeletal and orthopedic care to our athletes, and broader partnerships at the Warren Alpert School of Medicine. So big picture, want to give everyone a sense for the key pillars of the team within wellness and performance. We have sports medicine, sports nutrition, sports psychology, and sports performance. Our sports performance team are also known as our strength and conditioning team. Hopefully, many of you have already met or interacted with your strength and conditioning coach. They are absolutely critical for the training and conditioning of our student athletes and work very closely with our sport coaches to ensure that our athletes are resilient, prepared, and developing and growing as athletes. The focus of this conversation is the clinical team, so really sports medicine, sports nutrition, and sports psychology. We have an incredible team here at Brown Athletics, and I'm thrilled that you're going to be able to meet some of them here on this call. But this team works very closely together. There really isn't a day that goes by where we're not actively interacting. And that's something we take very seriously. We work in an integrated and collaborative way to provide care for our student athletes, and then also to help our student athletes develop on the performance side as both human beings and as athletes. So we really take an athlete-centered approach, which you can see here. We put the Brown student athlete at the center of our equation, and we're focusing on helping these human beings develop, not just athletically, but to develop skills for life. So we really focus on this idea of developing prepared, resilient, capable, and empowered human beings. And then wrapped around that is an incredible team of support. Within athletics, we have over 30 professionals who work with our student athletes, and then the broader team across campus is, including University Orthopedics, is over 100 professionals that work with our student athletes. So it really is a broad network of support. And stitched around that is a consistent focus on integrating and collaborating to provide holistic care. So if we can move on to the next slide, I'll give you a little bit more insight into what that means. This is a busy slide, but I think big picture, we really, again, put the student athlete at the center. We take an athlete-centered approach. And then wrapped around that on their day-to-day, there are going to be cycles of training and recovery. We know that it's in recovery, and in particular sleep, where athletes are adapting to their training. This is critical, and we emphasize how important good cycles of training and recovery are, not just for athletic adaptation, but for the overall well-being and resilience of our athletes and their performance in school. And then sitting outside of this in this outer band, these are all the habits and practices, factors that we know contribute to well-being. These are things that we really try to focus on educating and empowering our student athletes to understand as key agents in their own journey, both athletically and from a health and well-being standpoint. So again, the idea is really consistently, like we take a student-centered approach on the academic side, we take an athlete-centered approach on the athletic side, and are really encouraging our athletes to own their journey. And with that, we want all of our student athletes to know that this team that you'll meet today, but also the broader team, we are here for all of your student athletes. And we found consistently that the student athletes that reach out, connect, be curious, ask questions, dig deeper are the ones who get the most out of their experience. And that's why we're all here. So we encourage your student athletes to approach us with questions. We're here to help. And so hopefully this paints a broader picture of how we think about the support for your student athletes holistically. And then the final slide I'll share before I hand it over to the great clinical team here is we really see our mission, not only to help and support, but to empower our student athletes to thrive in competition in life. We recognize that, the 4-year journey here is going to be an incredible journey, and there's an opportunity for our student athletes to develop as human beings and competitors. That's something we really focus on. But we're also really focused, as I mentioned earlier, on helping to empower them with skills for life. And the team you'll hear from today are central to that. So wanted to share a bit philosophically about how we approach this and how we think about things as a team. And now I will hand it over to Beth Conroy, Head Associate Athletic Trainer, to talk about our clinical team.
As mentioned, I'm one of the athletic trainers here at Brown. I've been here for 18 years. I currently work with women's soccer and women's water polo, but I've worked with a variety of our 30 plus sports here. The head of our current department is Dr. Hung Lei. He's our chief medical officer who specializes in primary care with sports medicine. And it's been great since he started with us. Next up, we do have Dr. Holstein, Dr. Mercaccio, and Dr. Shambaugh, who work with University Orthopedics, and there are orthopedic surgeons associated with all of our teams. They lead up a vast group of specialists over at University Orthopedics that we do consultations for surgical cases, non-surgical cases, and they're also affiliated with Brown University through the medical school. Next, we have our team of athletic trainers, which is led by Matt Whalen, our Associate Director of Athletics, and then myself and Brett Masterpole are 2 associate head athletic trainers that oversee 13 additional athletic trainers. Every team has an assigned athletic trainer, so if there's questions, we do know who, and I believe the website has, like, on our staff directory, it lists who's with which teams. Currently, we've had no turnover this summer, and so everyone has been working with their teams to get their clearances done. Next, we have Britton Davis, our clinical sports psychologist, who's been working with us for the start of the 3rd year. And she helps us in regards to everything from general mental health conditions like anxiety, depression, and then also works with our teams on sport specific performance. And she'll touch on that in a few minutes. And then next we have Emily Tessier, who's our athletics dietitian. She's currently out on leave, which is why we have been graced with Tracy's presence today to go over what services are available regarding sports nutrition. Both of them work with us regarding general health questions regarding nutrition all the way to sports performance, what the students should be eating prior to practice, prior to competition, post-practice, competition to help make sure that they're in the best position possible. And next I get to introduce Dr. Lei.
I think you've heard this a couple of times, and you'll probably continue to hear the descriptive terms integrative and collaborative, because that's really what how we describe our relationship with our on-campus partners, which really serves an extension, but also an integral part in delivering healthcare for student athletes. I really want to highlight just a handful of our on-campus partners, and they're all under the umbrella of health and wellness services. So the first is health services. It's really comprised of a diverse team, 7 clinicians, 17 clinicians, 7 MDs or DOs, the other 10 being nurse practitioners and PAs. They offer primary care as well as urgent care, and really see an array of issues that students may experience. We do have other on-campus services that are helpful, including labs, pharmacies, and X-ray. So it's pretty convenient for students if they have to really address some of these concerns. In addition, you'll meet Tracy Bergeron, who heads our nutrition department. This is really for ongoing care for specific consultations, but also any nutrition-related concerns that a student may experience. The second department, in terms of our on-campus partners, is CAPS, which is short for Counseling and Psychological Services. I will let Dr. Davis speak to this because she will have a slide committed to this, but we do have therapists as well as on-campus psychiatrists for our students. They offer both individual as well as group counseling when applicable. Be well, really, I would think of this department as anything that has to do with health promotion. So some examples include sleep, stress management, advocating or helping students to be self-advocates for their physical, mental health, sexual health education, just to name a few things that they do, as well as even address issues like substance use. if there's ever a question or concern pertinent to that topic. We have a on-campus EMS service for emergency scenarios. So they provide both basic and advanced emergency medical care. They can provide transport. It's nice. All of these on-campus resources are free for our students. So that includes the EMS if it pertains to transporting to the local ER if clinically indicated. In addition, they have an extra transportation service to help support students who are trying to get to an appointment, and transportation may be their barrier. There's a what we call a wellness wagon, where if you plan ahead of time, they can help get the student to that necessary medical appointment if it's off campus. And then lastly, Lori Conley is going to talk a little bit more about this, but we have an office to help with accommodations and supporting students with disabilities. And so I really will let Lori speak at length regarding that unique department, which is very, very helpful and vital for some of our students.
Hi, I'm Britton Davis. I use she, her pronouns. I'm happy to be with you all today. Thank you for joining us. As you can see in this slide, it's very busy, but it really highlights the robust services that are available to your children, your student athletes, our student athletes. And I don't need to go into all of the details as much as really highlighting the major takeaways. One being that there is a robust amount of support. Like Dr. Lay said, whether it's related to clinical mental health care, health promotion, accommodations, or other supports that are outside of anything we could imagine to be possible at this particular moment in time. The first being myself, I'm a clinical sports psychologist in Brown Athletics, but I'm part of a much larger team of clinicians over at Counseling and Psychological Services. The reason why that point is important to note is that I am one person for 34 teams and about 1,000 student athletes. So clearly having a much larger team that is interconnected is important to make sure that all student athletes are feeling well supported. It's also important to note that all of my clinicians and colleagues over at CAPS have worked extensively with student athletes. So even if they don't hold the clinical sports psychologist title, they have tons of experience and are eager to work with our student athletes in providing support. Another key part that I want to highlight is timely care. This is I believe it's the second year we're going into our contract with Timely Care. It is an online teletherapy platform with trained licensed clinical mental health providers. Every student at Brown has 12 free psychotherapy sessions per academic calendar. Those can be used at any time, even if the student athlete is at home over winter break or over the summer breaks, as long as the person remains within the continental US. So that's an amazing resource to take note of. We also included, I saw it came through the chat, how to register. So encourage your children to register because this is a support that is always available to them so long as they remain Brown students. The next are the Office of the Chaplains and Religious Life. We understand that not everybody is needing or wanting psychological care, but might have spiritual concerns and or questions about mortality and or processing the death of loved ones. They offer a weekly bereavement group as well as a gratitude group. So this is another amazing resource for all students, including our student athletes. Dr. Lay already touched on Be Well. Long-term therapy is always an option. Long-term therapy is something that student athletes can come to Brown already having, or it is something that they can seek out on their own. You can use platforms like Psychology Today or Zen Care in order to identify therapists who may be in network and might have the certain specialties that your student athlete is looking for. You can also negotiate sliding fees at times if money is a barrier. Other resources on campus consist of student support services. This is unique to most universities within the Ivy League. I previously was at Penn. They called it student intervention services there, but a very similar support. Essentially what this is that you can contact them to file a care report. And this is for anything related to mental or physical health, or if there are any concerns related to students. You can also encourage your student athlete to meet with a dean to process mental or physical health, loss of a loved one, and they can do what is called writing a dean's note, which gives them permission to work with the professor to have accommodations that are not necessarily as robust as Lori will talk about from student accessibility services, but are at least an invitation into exploring pathways to support and thriving during the coursework while also managing unforeseen life circumstances. Student accessibility services, which Lori will touch on in a couple slides, is another very important office to take note of. One transition that you all as parents will probably be coping with, as our student athletes will be as well, is that they're adults. And it's very hard to look at them going into their freshman year and see that they're adults. I have a 15-year-old and I can't imagine seeing him as an adult in 3 years, but the reason why that's important to note is that now they have to have some agency when it comes to their own health care, especially when it comes to filing accommodations or meeting with a dean. There are certain conversations that will have to be initiated by our student athletes. So really encouraging them to find their voice and knowing that you have trusted individuals such as myself and those on this call who can help them navigate where to go next. Another important thing for you all as parents to know is that we have the administrator on call, and this is an administrator through the Division of Campus Life, and they have a rotation that shifts. And these individuals can assist you with problem solving, resource gathering, so that appropriate offices can provide timely and coordinated follow-up for your student athletes. And then the last one I'll touch on is that we have a 24/7 sexual assault response line as well. All of those are linked in this slide, so feel free to come back to it at any moment. Long story short, we have an amazing team of individuals who are dedicated to providing holistic support for your student athletes. And all of us on this call work really closely together to make sure that nobody is slipping through the cracks and everybody is getting that interdisciplinary support. Next, I'll pass it to Tracy Bergeron.
So my name is Tracy Bergeron. I'm a registered dietitian. I've been at Brown now for about 10 years. So my colleague, as mentioned in the beginning, my colleague Emily Tessier is the sports dietitian. She's currently on leave. We expect her back at the very end of September, early October. So her office is located right in the Varsity Center and right on the athletics campus in the OMAC. So she's right there, kind of in the center of it all with the athletes. And the fueling station is actually there right outside her office as well. So athletes can schedule an appointment with her going through their athletic trainer. She has 2 clinic days a week that are reserved for individual nutrition counseling. And on the other days, she does a lot of team talks, like fueling talks with teams. She's available for Q&A. You'll see her a lot outside the fueling stations. Practice. She tries to drop in at practices, things like that. And then my office is here in health services. So I actually have a full-time clinic schedule 5 days a week during the academic year. So I am in the health services building at 450 Brook Street. So scheduling with me is just a little bit different. Athletes can call that number that you see on your screen. And they can be referred, but really by anyone. They can be referred by their athletic trainer. Sometimes I have students that are referred by a medical provider, a CAPS provider. I am also a certified sports dietitian as well. So we're both sports dietitians. I just happen to be housed over here And the difference between Emily and myself, so I would say, for the most part, the athletes, of course, enjoy seeing Emily because they see her over there. She interacts with the athletes a lot. But her clinic schedule can sometimes get a little bit jammed up. So for athletes that are looking for more long-term care, I am available for that since my clinic schedule is 5 days a week. And next, I think we are turning it over to Sass.
I'm Lori Connolly. I am one of the accommodation specialists here at Student Accessibility Services. I am coming up on 2 years here at Brown. And the purpose of SAS is to provide accommodations to individuals who have diagnosed disabilities. So we provide an equitable, inclusive, and accessible environment in academic and co-curricular services and activities. On the screen, you'll see the basics of the who, what, when, where, and how in regards to how do you register with SAS and what is the process for getting accommodations here at the post-secondary level. So we are the ones who work with undergraduate and graduate students with disabilities to provide those accommodations necessary to provide that equitable access on their journey here at Brown. So if your student had accommodations in high school, it is possible that they would qualify for accommodations here at the post-secondary level. There is a slight shift between high school accommodations and college accommodations for those of you for whom this is your first student heading to college. In high school, accommodations are provided to guarantee success. Once a student turns 18 or enters post-secondary, that shifts to access, and the success piece becomes the responsibility of the student. So that's a little bit of a shift in a mindset for students that sometimes catches them off guard. In addition to that, there's the self-advocacy and agency piece, which Dr. Britton Davis had touched on earlier, where once a student turns 18, they become responsible to take ownership for their learning. So they are the ones that need to make the outreach with student accessibility services. They're the ones that need to make the request for accommodations and to upload all the information to their student files. We can speak with parents if we have a FERPA release. So FERPA is that Family Educational Rights and Privacy Act, which ensures the confidentiality of a student's academic information. So a student can give a release of information for us to speak with parents, but that doesn't change agency to the parent. So students still need to be the ones making the requests. And without a FERPA form, once they turn 18, that shift occurs also where we can only speak with you regarding your specific child if we have a FERPA release, which is going to be new for those of you that had accommodations in high school because you're used to being able to speak for your child, and that shifts once we hit post-secondary. So that's a little bit of a change for parents. Documentation needs to come from a licensed medical provider. We do review that documentation and we meet with students either via Zoom or in person, their preference. And we do discuss what are the disability related needs that you're experiencing, be it in academics, in housing, in co-curricular activities. And we determine what barriers there are and then what supports, resources, and accommodations can we offer that will remove those barriers to provide an equitable experience for your child. You can register with SAS at any time. Some accommodations, such as housing, do have deadlines, but academic accommodations you can get at any point in time. They can be adjusted at any point in time. We do recommend registering as early as possible. Until a student reaches out to us and registers, provides documentation, meets with us, activates their accommodations, and meets with the professor, it's as if they do not have accommodations. So the earlier your student can register and get in to meet with us, the better it will be for them in regards to those accommodations to provide that equitable access to their academic journey here. We are located in Page Robinson Hall, up near the main green on the 5th floor in Suite 512. On the screen, there is our phone number, and we've linked the website where you will find all of the information you will need regarding SAS and the forms that you'll need in order to register with SAS and upload documentation. And registering is a simple 3-step process. There's an online intake form. It asks what your disabilities are, what areas you would like accommodations in, and then what are those disability related needs and functional limitations that your student is experiencing. So we'll review that, we'll create your account. Your child will receive an email that says it's ready for uploading documentation. You'll get the documentation from a licensed provider and you'll upload that to their file. And then they will call the office and schedule an appointment to meet with one of us. And the initial appointment, the intake, can take anywhere from 30 minutes to an hour. And the student just shares how is their disability impacting them in the academic setting or the housing setting for which they're requesting accommodations. And then together we'll decide what supports and resources are available. We'll put those in, and then your child will need to activate those accommodations and interact with the professor to make sure that they're being implemented as written. That self-advocacy piece, once they hit post-secondary education, becomes a learning curve for some, but it's an area of growth for many students here. So if you need information about how to register or reaching out to us, that information will be on the slide.
We've had a lot of great questions come in, and we'll get to those in just a second. I want to go through some questions that came through our registration first. Dr. Lay, we have a number that I think are for you. The first one is about transitioning a student athlete's care from the team they already have in place to their experience in Brown.
If your student or if your child is currently being cared for specialists back at home, and there's some students who see their specialists infrequently, that is, it's sufficient for them to continue care at home when they're home for breaks. There are other situations where the care will have to be continued as they transition to a new environment. In those examples or circumstances, it's best to try to meet with a health service provider before they arrive to campus. And so my understanding is that health services has sent out a letter to invite families to schedule what they call a special care plan visit to allow these discussions to happen in more detail. This would be a telehealth call with a health service clinician, with students and families to discuss how do we best transition out care if you have a specialist that you're seeing currently. In addition, it's always advisable to have access to the last medical records in terms of either clinical notes, diagnosis like labs, any sort of diagnostic information, as some of times we may request that. And so the take home is if you want to learn more, there is an opportunity to meet with an on-staff clinician here if you request for a special care plan visit.
The next question is specifically about concussions. And does every athlete who gets a concussion see a specialist? And if not, why not?
My training, a part of my training was in concussion care. So for student athletes who suffer concussions or sustain a concussion, I usually will see them. Rarely, if there's a prolonged recovery, we may have a discussion of seeing them, having them see by a specialist off campus. But that's rarely the case that we need to have them see a neurologist. But a bulk of my specialty training was in concussion care. So typically the process is for them to see me first. I do work closely with a lot of on-campus partners because, as we know, concussions can really impact their day-to-day function and activities. And so we want to prioritize their recovery. But secondly, the next thing we always talk about is how are they adjusting academically. And so, my approach is pretty holistic to also make sure that we're addressing the components that may be impacted following a concussion or head injury.
Okay, well, this segues nicely to the next question, which is about other specialists. If a student has a sports-related injury and needs a specialist, how does that work?
So Beth outlined the team really well. I do see also the majority of the sport-related injuries. With that being said, we have a lot of partners for cases where we need additional insight. So the team surgeons, the team orthopedic surgeons have their own clinic a half a day a week. And so they have on-campus presence. In addition to that, their campuses and clinic sites are quite close to Brown. And so in the event there's a unique injury or a second opinion that we need, we will help get the student seen by the necessary specialists. And so it's either identified through their trainer, myself, or it can be referred by one of our team orthopedic surgeons that see them when they're on campus.
All right. And one more for you. What is the cost of receiving medical treatment on campus?
Regardless of the student's health insurance, any medical care that they receive on campus is free. So that includes medical services at health services, medical services that they get in the athletic training room, mental health services that they get from CAPS. All of that we don't bill insurance. It's just really free of charge. There are some cases where you may see a fee. So one example that I use is where pharmacy and prescription costs will go through your insurance. So that will have an associated pay depending on the insurance that you have. If your student gets an on-campus X-ray, in particular, we don't have the bandwidth to bill out all of the insurances across the country. And so if someone gets an X-ray on campus, we typically would charge them the cost of the X-ray, which is about $100, and then they get a receipt where you then can submit for reimbursement after the fact. We also offer students the option of getting the X-ray off campus if they want to have the off-campus location bill their insurance directly. So there are multiple options here when it comes to X-rays, but that's the one exception in terms of a cost related to the care that they receive on campus.
Thank you. I'm going to give you a break, Hung, and this next one's for Beth. Beth, if an athlete is injured during a sport, does the school cover any related health expenses or all the costs the responsibility of the parents' insurance?
We do have a secondary insurance, and right now, outside of the secondary insurance, there is the SHIP. We call it the SHIP. It's the Student Health Insurance Plan. Waiver process is open. Every student is automatically enrolled in that system prior to arrival on campus. They have to complete the waiver for them to use their parents, typically the parent or guardian's insurance as their primary. All bills start by going through the primary insurance, whether it's SHIP or private insurance. And then after that, if it's a sport related injury, something that happened at conditioning, lift, practice, supervised by coaches, then we do have the secondary insurance that picks up customary and reasonable costs that providers charge. So sometimes there is a cost to the family associated to that, as some providers around the country do not charge insurance as customary and reasonable, but most of it does get picked up by our secondary insurance. But something happening, a student getting hurt on a Saturday night would not be covered by our secondary insurance if it's outside of athletics.
Okay, thank you. And we have a great colleague who's dedicated specifically to insurance. She did a webinar with us earlier this year that you can go back and watch, or you can look up SHIP on the Brown website and get more information and book an appointment with her if you have specific questions. Tracy, I have a question for you. One came through in the chat that was about what the fueling stations offer. Can you talk about what's offered at the fueling stations?
Yeah, absolutely. So really a variety. So different bars, everything from sort of like Nutri-Grain bars, Big Newton bars, things like that. There's proteins like string cheese. We have things for folks that are like gluten-free. Gosh, now you're making me think. There's a whole lot of peanut butter crackers. I'm trying to think of what we keep in our fridges too. We have certainly like sports drinks, Gatorade, things like that. as well. So different proteins, different grains, folks for people with allergies as well. And Emily does a great job, like partnering like with different vendors as well. So we're always like trying to get new things in. Tart cherry juice is a big one. Charabundi, that's a great recovery fueling source that we use. So things like that, the gummies that we recommend for post fueling. So lots of different options for folks. So bananas, fruit, fresh fruit, things like that. So options for pre-fueling and both post fueling as well.
Thank you, Tracy.
Yes.
I've got a few for you, Dr. Davis. One that came in was about a student who might be experiencing a mental block on the field. Is there somebody that they can meet with to help them visualize success and get past that block?
Yeah, it's a great question. Yes. So that doesn't necessarily mean that it has to be me. Again, I have the title clinical sports psychologist, but there are a lot of transferable skills and knowledge for all of my colleagues over at CAPS who are generalist practitioners. So for instance, they're trained in CBT, they're trained in various other modalities that could be beneficial in helping individuals work through mental blocks and or creating coping mechanisms that would be beneficial in order to better understand what is contributing to the mental block and how to work beyond it. And the reason why I specify that it doesn't necessarily need to be me is that that's often a place where I've witnessed student athletes getting stuck and that they assume that the only person who can help them is a clinical sports psychologist versus understanding that there are many skilled clinicians who have experience working with individuals who are overcoming a myriad of blocks in their life. So trying to find a way to get the best support possible without necessarily having the title of the best is something that I encourage all of our student athletes to exercise. Because I would rather have them get in and get support from somebody over at CAPS or seeking somebody out in the community than waiting for my availability. And then what was one block in one game becomes a mental block for a whole season. So definitely work with your student athlete in order to encourage them to get care. And understanding that the major part outside of individual factors like motivation, diagnosis, the major contributing factor to therapeutic change is the relationship. So if they have a trusting relationship with whoever their provider is, they will see some positive therapeutic gains. Again, that trumps anything related to treatment modality or training that the person might have. But if they need help getting connected to somebody, working with their athletic trainer, Dr. Lay, anybody on this call could be supportive in pointing them in a direction that would be beneficial.
Thank you. And this connects to another question we got, and you sort of answered this a little bit, but is there a wait list to see you? And what other suggestions do you have if somebody's having trouble getting an appointment?
Sure. I don't keep a formal wait list just because that assumes that, like, let's say if somebody reached out to me and I might assume that I have availability in 3 months. I don't want a person to have to wait for 3 months to see me. And it also assumes that the same thing that they were dealing with 3 months ago is still relevant today. But generally speaking, yes, there is a little bit of a wait to see me. And honestly, most CAPS clinicians as well. Universities are not able to hire or house enough therapists to be able to provide ongoing psychotherapy for every student we serve. And the reason being, it's not a lack of funding, it's not a lack of space, it's just that we can provide healthcare because you might see the individual once a year, if that, or you can attend Brown for 4 years and never need to go into health services. But the nature of therapy is repeat sessions. So caseloads do fill up, but that does mean that there are other supports available, such as using your own insurance and just paying the copay or working with a therapist in the community to do a sliding fee. Those are always options. We have a number of therapists within the community who are within walking distance, and a lot of our student athletes have really enjoyed working with them. Timely care is another option. Again, 12 free psychotherapy options or sessions per year. I've been in the field practicing for 18 years, And I have never experienced a 12 free sessions. I mean, that's huge. In adult life, like it's something that we often don't experience. So encouraging our student athletes to capitalize on that wonderful opportunity as well. But if there is difficulty connecting, I think anybody on this call could be a resource. Even if they don't have the answers right then and there, they'll work within our group in order to determine what next steps your student athlete should take.
Thank you. Yeah, Timely Care is a fantastic resource. Everybody should know about that. This next question, I think I'm going to direct to Joe, and then if anybody else wants to jump in, we had somebody write in that said how much they appreciate the holistic approach that this team offers and the slides depict. Can you talk about how this approach translates to the coaching staff?
I think across our ecosystem, we really have everyone integrated into this approach and mindset. It's something we've been working hard at building over the last couple of years since I've been at Brown, and this majority of this team is relatively new as well. So it's core to kind of the esprit de corps, if you will, that we're building, and our sport coaches are very aware of that. I think we do have a couple of things that are built in, particularly from the mental health support standpoint. Dr. Britton Davis does provide mental health training to all of our coaches, including all of our student athlete facing staff. So we're well integrated there in tools like active listening, how to connect student athletes to care, how to be there and hold space and time for our student athletes. And then more broadly, from a holistic, both, sort of athletic development standpoint and then care for, the well-being of our student athletes, we have introduced a concept called performance huddles. Where on a weekly basis going into competitive season and during competitive season, the sport coaches are meeting with our athletic trainers, our sports medicine team, as well as our sports performance coaches to ensure integrated support and care for that team and individual athletes as needed, so that everyone is on the same page. For example, with an athlete returning to play following injury, we need to make sure that our athletic trainers are in sync with our sports performance coaches and sport coaches to ensure effective return to play. And then more broadly, from a performance standpoint, it's really, really critical that that team stay integrated, right? We have to know if there's a heavy loading day on field, that the strength and conditioning or sports performance coaches are aware of that, so they're not also heavy loading within the gym, so that we're ensuring a good sequence of cycle of both loading and recovery. And then, of course, other things come into play, around skill acquisition, both on field and in the strength and conditioning center. So we really do try to ensure both on the athletic development side and from a health and well-being standpoint that we're integrated. And then that performance huddle team will bring in appropriate resources as needed, like Dr. Britton Davis, or in this case, Tracy Bergeron, or Emily Tessier, if sports nutrition support is needed, or for example, the team needs a team talk on some particular topic, including building culture within the team. So we really try to respond to what we're hearing on the ground, and then provide the appropriate resources to support that team and those individual student athletes holistically. So hopefully that helps provide more insight.
Another question came in about SAS and accommodations. Lori, we had a question about registering for accommodations with SAS. Does that require a student to do that every year they're here or just once when they first arrive?
So a student will register with us once when they first arrive and meet with us to discuss accommodations. Certain disabilities that fluctuate will require updated documentation. Some of those mental health conditions like anxiety and depression that have a tendency to wax and wane will require yearly documentation. If it is a learning disability or ADHD or hearing loss that doesn't go away, the first documentation you provide to us is all we'll need for your time here at Brown. And then if the accommodations that have been approved for you are appropriate and they have removed the barriers, then you don't need to meet with us. You'll just need to activate accommodations each semester for those new professors. But if some other challenge comes up and you need to talk about it, we will meet whenever it is that you feel you have a barrier that you want to talk about. And if we need to adjust accommodations, we can do that at any point in time.
Question for you, Beth. There are a number of forms that folks need to get in order before getting to campus. Can you give a general overview of what medical forms are going to be required before an athlete steps foot on campus?
Yes, and I believe we have the link that we have available that is directly to our website, which has the medical checklist that all student athletes are required to complete. There's technically 9 steps. 4 of them are acknowledgements for consent to treat, consent to disclose information, consent to acknowledge our insurance, our insurance program, which also covers the ship and the secondary insurance. One step is a health questionnaire, which we have every student update for us annually. Another is just that they have to do an impact test, which is a neurocognitive test baseline that we need to update every 12 months per the NCAA. The next is also a physical form, which is mandated by the NCAA that they have done 6 months prior to start of participation. That's been posted since the incoming students have been accepted to campus. They had access to that in our old system along with our new system, and it's been active on our website, and the athletic trainers have sent it out. And in then there's also a sickle cell requirement that's mandated by the NCAA that's part of the physical. And all that got sent out a couple times. We try to hit the students that we have this information available and needs to be completed. They also see it when they log into their patient portal for the first time under forms and requirements. If anyone hasn't been communicated to at this point, they should reach out to either myself, Dr. Lay, or their athletic trainer to find out why they're not getting that. Sometimes it can be as simple as there's a glitch in the system regarding their active status on a roster. And then once they're actively on the roster, they can then see our information.
Dr. Lay, the number of resources is impressive here at Brown, especially with your team. We had a question that came in earlier that was just like, where do I start? Where do I make a connection with somebody? If somebody's confused or not certain about what the best place is to start, what do you recommend in terms of reaching out?
Yeah, I really think the best person for your student to be familiar with is going to be your athletic trainer. They are well versed with the resources here, and sometimes it's a matter of where do you start, and the athletic trainer can screen it out very quickly. They see the athletic trainers nearly every day. They see them on the weekends. They see them at night, and so this is really going to be your family extension away from home. And so I would say any questions, please feel free to reach out to the ATs.
And as always, if you have questions after this webinar and you don't know where to send them to, whether it's about your athlete's experience or anything else, you can always send them to me, my department at family@brown.edu. We are getting towards the end of our time. I like to end things with just getting your final thoughts. While I do this, I'm going to chat out a link for a survey that I hope everyone on the call will take. It's 3 questions. It's really quick, and it allows us to improve our services as we provide information for you throughout the year. So I'll chat that out, and then we'll just go around and get your closing thoughts. Lori, I'll start with you.
Thank you all for taking the time to be here today and to get an overview of the services that are available to your student athletes. We look forward to welcoming them to campus.
And it was discussed earlier about having the student be a self-advocate for themselves, both in completing their forms for us, but also in how they feel. They're the only ones that know their bodies, and they are their best advocate, and teaching them, educating them on how to use their voice is important.
Thank you. Tracy.
Thanks everyone for joining us today. I hope to get to meet some of your athletes or Emily once she's back. Please encourage them to check out the fueling stations. There's multiple fueling stations. I did forget to mention that, so there's more than one. But just encourage them to, if they're on their way to practice or on their way after a game, just encourage them to stop by. But hopefully we see you. And again, welcome, congratulations and welcome to Brown.
Thank you. Joe?
It's difficult as an 18 to 22-year-old, in that range. It can be intimidating to approach folks, but we are all here for your student athletes. We're all here for you. and really encourage your student athletes, if they're curious, if they have questions, to reach out. And with that, I'll also echo the thread that Dr. Lay mentioned. Our athletic training team is fantastic. They're a great group of professionals, and developing that connection and that relationship with your athletic trainer, if you're a student athlete, is really, really important. They are sort of a hub and spoke. They can connect your student athletes with other experts within the team, to provide them with answers to questions that they have. So, big picture, leverage the resources, and then to, welcome everyone. Super excited for you. It's going to be an incredible journey for you all, and for your student athletes. I'm sure you're going to see tremendous growth, and I wish you all an incredible experience along the way.
Britt?
Likewise, I'm so excited to meet your student athletes coming to Brown. One of the final remarks that I'll make is just how much it takes a village. So encourage your student athletes to reach out for support, whether it's their care team and individuals on this webinar, or other supports in camp, on campus, or within athletics. So for instance, we have the Bruno Cares peer-to-peer support program that is training our student athletes to be peer supports for each other. We are also piloting this year a similar program for coaches to also participate in what it means to be a peer support, or a mentor through any sort of informal non-clinical support. So we have a robust system of individuals who are eager to be there with your student athletes. So encourage them to talk. And I don't have the bag tag with me, but there's like a Bruno Cares bag tag that our trained student athletes wear around campus, and they wear them very proudly, and their sweatshirts, and water bottle stickers, everything. And those will be individuals who they could just go up to and just have an informal conversation. So encourage them, if they're especially transitioning into what it means to be a student athlete at the collegiate level, find those Bruno Cares teammates. They can just say, like, what is this all about? I'm overwhelmed. And there'll be people who can listen for sure.
Fantastic. Thank you. And then finally, Hung.
As soon to be parent of two, right? As a parent, you want to anticipate every challenge and barrier that you can. And unfortunately, you just can't. And I think I hope that this forum at least give you one comfort, which is that there are a lot of incredibly talented, but more importantly, caring individuals here at Brown. And so we welcome the partnership that we're about to have with you and your student. But just know that, I work with just incredibly caring folks, and we just want your student athlete, your child, to thrive while they're here. And if there's any way that we can support, please don't hesitate to reach out.
Those are great words to end on. Thank you, everyone. I want to thank all the panelists. This was a fantastic discussion today, and I want to thank everyone who joined us. We are so glad to welcome you to campus very soon. If you do have any final questions, please send them my way at family@brown.edu. And for everybody out there, I want to wish you a great rest of your day wherever you are in the world, and take care.